Childhood myopia is no longer just about children needing spectacles. It is fast emerging as a serious public health challenge with long term consequences for vision. With increased screen use, intense near work, and reduced outdoor activity, myopia is appearing earlier in life and progressing more rapidly than ever before. It is now known to raise the risk of sight threatening conditions such as retinal degeneration, glaucoma, and early cataract if it worsens through childhood. Responding to this growing concern, Zamindar Microsurgical Eye Centre has launched a dedicated myopia clinic at its Children's Eye Hospital and introduced the Pristine OBM 2.0, an advanced ocular biometry and myopia monitoring system that measures not just spectacle power but the actual growth of the eye through precise axial length assessment. By moving beyond traditional eye tests, this technology allows clinicians to objectively track myopia progression and intervene at the right time. As one of the first centers in Karnataka and third in India to adopt the Pristine OBM 2.0 for pediatric myopia care, Zamindar Children's Eye Centre is shifting the focus from correction to prevention. To understand how this technology is changing myopia management, what parents should watch out for, and how early action can protect a child's lifelong vision, we speak with Dr. Samina Zamindar, founder and chief medical director of Zamindar Microsurgical Eye Centre. Thank you so much, Doctor, for joining us today. And firstly, we would like to understand that what is childhood myopia and is it a major public health concern in India currently?
Uh, Thank you so much for inviting me, Daily Salar team, for creating awareness about this problem of myopia. Myopia is a condition, in layman's language, it is known as short-sightedness, where a child or an adult needs to wear glasses to see distance things clearly, right? And I would like to share with you that a study was conducted to find out the prevalence of myopia. And this study aimed to predict the myopia prevalence in future also. So what we have learned is that myopia prevalence in the year 1999 was only 4% among children. Today, it's about between 25% to 30%. And by another 10 to 15 years, the prediction is that 50% of our children will become myopic. That means 1 out of 2 child will need help of a glass to see distance. And you can imagine that it is so very important for a child to see. If they cannot see well, they cannot study well, they cannot play well, they cannot live their life fully as children. And when these same children, when they become adults, they are more likely to develop vision threatening conditions like cataract, retinal detachment, retinal degenerations, and glaucoma. So you can imagine how important it is for all of us to get together and take the required steps to reduce the progression of myopia, reduce the incidence of myopia.
So, if you could also explain us that why is there increase in the prevalence? I mean, is it only the screen time that's a major contributing factor, or are there any other factors as well?
So, screen time is about 60% of the cause. And screen time, not just while that we talk about a child using screens for entertainment, but mothers using screens to see that the child eats food.
Hmm.
Okay. A screen is used for information. A screen is used at school. Screen is used to do project work at home from school, right? We are using a screen right now.
Yeah.
So in COVID, a lot of children use screen to educate themselves. And we have to understand that in certain Asian countries like, say, Singapore and Malaysia, already there is such a huge prevalence. This is going to happen in India very soon because we are all trending the same lifestyle patterns. and concrete steps have to be taken now. So screen, yes. Besides screen, lack of avenues in the densely populated areas of our cities, where the child does not have an option to go out and play, to go and have some sunlight, which is so important. The role of sunlight in reducing myopia is established. So we don't have those avenues. So there is something which the policymakers and the governments and the town planners will have to help in.
So also when we talk about the screen time of children, is there a age limit that until this age? Because again, technology and screen have become an aided part of the tool to teach or just for even play. So is there an age limit that they should not be exposed to screen at all until a certain age?
Absolutely. The Pediatric Ophthalmology Association recommends that from 1 to 3 years, from 0 to 3 years of age, the child should have zero screen time. So that is something which is of paramount importance, right? And more than anything, this awareness, and I'm glad that I'm talking to you because through your channel, we are hoping that many more people understand that till the child is 3 years of age, they should not indulge in any screens.
Also, what makes the early onset, especially in the early childhood, much more dangerous than probably myopia in the later stages of life at 8, 9, or even as I think early teenagers are something that we normally see that people start getting glasses. So, why is it more dangerous when it's early?
I think this is a very pertinent question what you have asked because getting myopia is like getting onto a bus of myopia. When you get into the bus, what happens? The bus will keep moving. So the earlier you get into the bus, you will have more amount of myopia. If my child or my grandchild gets myopia at the age of 2 years, by the time the child becomes 16 years of age, the myopia would become a high number of myopia. Any myopia which is more than -6 diopters comes under the high risk myopia group, where all problems are more common with such groups, right? And the chances that a child will become high myopic are much higher if the myopia starts at an earlier age. Like what I said, it's like getting onto a bus, hopping onto a bus, and the bus will keep moving.
So the number keeps increasing, especially if the lifestyle changes are not made, and if they are, because screen exposure is something that is nowadays expected while growing up, at least in terms of education or play. So the number keeps increasing.
I would agree with you. And here what I'm asking is not a small feat at all. I'm asking for a cultural change. I'm asking for a complete lifestyle change for all of us, for an entire community to acknowledge the problem we have at hand, acknowledge the seriousness of the problem, and take action now. We, as the adults of the community, are the role models for our children. And if we indulge in screens, that's what our child will learn. Everybody would have seen a child screaming when a mobile phone is taken away from the child.
Mhm.
Isn't it a common sight?
It is, yeah.
Right? Why? Why, in the first place, the child wanted to look at the mobile phone? Because they have seen their parents, caretakers, grandparents always glued to mobile phones, right? So, this has to change. A culture of not indulging in mobile phones when you are at home, doing something together as families, which is nothing to do with mobile phone, like playing board games, talking, reading a book together, any such thing might be more effective in reducing the harm from this progression of myopia.
So it's not just the childhood myopia, but it also means that adults around have to completely change how they spend time with children in general.
Absolutely.
Also, there has been the launch of Pristine OBM 2.0 in your clinic. Can you tell us more about that and how does it change the way childhood myopia is evaluated and managed, especially because it's the first one in Karnataka. So, can you tell us a bit more about that?
Thank you. See, in 2024, we established a separate Zamindar Children's Eye Hospital. Zamindar Microsurgical Eye Centre was established in the year 1997, and we have different departments like, of course, cataract, retina, glaucoma, cornea. But with after the COVID pandemic and after seeing as at the rise of the numbers of children who had myopia, we realized that there is a definite and an urgent need to start a children's eye hospital. And that's what we did in 2024. We started a Zamindar's Children's Eye Hospital. Last year in 2025, we established a separate myopia clinic in the Zamindar Children's Hospital because to handle and to take this problem of myopia more seriously. And this year, we realized that if we have to stop the progression of myopia, we will have to take some steps, which we started taking from the last 2 years, in the form of a simple eye drop, which has to be put at bedtime, or a special kind of glasses, which the myopic children wear so that the number does not increase very fast. The progression is cannot be halted, but it can be slowed down to a large extent. And in order to start that treatment, we would have had to take some 3, 4 different readings where a child will have to cooperate to sit on this machine and then that machine, and so much time would take for that. Now, with the Pristine OBM 12, this entire testing of 3 or 4 critical parameters happens in a few minutes in a automated and a child friendly manner, so that our detection of progression and our monitoring of progression is effective, easy, and child friendly. And so we can cater to many more children in that same amount of time with less inconvenience to the parents and children. So that's the beauty of the Pristine OBM 12. And we monitor all the myopic children through that machine. It's like just one extra test for all myopic children to predict that this child's myopia is on the progression and this child needs an early intervention to see that the myopia does not progress.
So, it's like a preventive measure since the beginning.
It's like a very important tool in monitoring the progression of myopia and a very effective tool because it gives us an
Yeah.
early indication of progression. And as soon as we can detect an early progression of myopia, we can take steps in the form of drops, in the form of glasses, and of course, like what I already said, in form of a more holistic lifestyle full of outdoor activities with sun exposure, reduce digital devices, and a healthy diet rich of colored fruits and vegetables.
Also, what would be your message to parents or caregivers that that can be takeaway regarding digital device use in early childhood? Uh, I mean, you've already mentioned that from 0 to 3, at least there should be zero digital device exposure. But any other messages for the parents and the caregivers of young children?
Role model. Be good role models for your children. Yeah. We will have to sacrifice some amount of our entertainment and connect with our child in different manner and understand their world. And that is what is the best gift you can give to your child. But a parent or a caregiver or a grandparent can only do that much. That's only one part of the story. My message to educators, my message to policymakers, my message to the government is that please create enough and more spaces, outdoor spaces, and for educators, there is a shut door policy which Singapore has applied for classrooms, that when the recess time, there are at least 1.5 hours of recess time where the classroom doors are shut. Children are not allowed to sit inside the classroom. They have to forcibly go outside and play. So smaller interventions like this from everybody together can help
Change.
us deal with this problem of myopia.
So, with parents obviously being good role models, and at the education level, having certain policies that allow children to go out and play and also not engage in screen. Uh, and at the community, at the government level, it's like to have spaces which allows more freedom to play, move around, and also gives sunlight exposure.
Yes, you've summed it up well. Thank you so much.
Thank you. And before we end, what is your long-term vision for myopia control and prevention in this community?
My long-term vision for myopia control is that, first of all, this prediction which this study says that by 2050 we will have 1 out of 2 child having myopia, 50% of our children suffering from myopia. That prediction is not true. Together we can change that prediction, right? Secondly, I feel that all these Pristine OBM 12 should be also updated, and future technology will help us screen not myopic children only, but regular children who do not have myopia, and find out a condition known as pre-myopia, so that the child, even before becoming myopic, we can do something for them to stop entering that bus of myopia, right? Stop myopia before myopia starts.
Thank you. Thank you so much for sharing such information with us and for telling us how to prevent myopia as well, what can really help our children. Thank you so much for your time.
You're very welcome. It was a privilege and an honor to speak for Daily Salar.